Hi, this is Dr. Srinivasan Patnam. Welcome to the Inpatient Services Part 3 Equipment Requirement in Inpatient Services. So, let us see what are the different equipments that are required in the inpatient services. So, here if you see there is a whole list of equipment that is required: beds, medical gas supply, oxygen cylinders for providing any ventilation that is required for the patient, dressing trays. In each ward there should be dressing trays, venesection trays, like where different kinds of trays are maintained for catheterization of patients to provide IV lines, and suction apparatus, blood pressure monitoring devices, stethoscopes, thermometers and pulse oximeters, crash cart where emergency medicines can be saved and regular usage medicines can be saved, put into that cart and carried easily towards the patient beds, and portable bedside diagnostics like portable X-rays, where these are small X-ray machines where they can be dragged onto the patient bed and the X-ray can be taken at the bedside. Okay. And tools for special procedures which are supplied on demand, like for example, a small glucometer where patient needs an immediate blood sugar level monitoring. So, a glucometer that can be done at the patient bedside itself. So, these are the different equipment, again depending upon the different hospital levels. So, they maintain with the sophisticated or advanced technological apparatus or equipments in the inpatient ward. Okay. Now, let us see the human resource requirements. So, what is the human staffing system in these inpatient wards? Like every inpatient ward has as we have seen in Nightingale ward or Riggs ward, the patients are there, and how the staff has to be placed into these wards. Okay. If the ward type is general inpatient ward, so there should be one doctor on duty and every 6 patients should have a nurse. Okay. So, that the nurse takes care of those 6 patients. Okay. And if it is a specialty or critical ward like ICUs, different ICUs that we have seen earlier, like ICU, ICCU, SICU, nurseries, all these areas where it is critical care areas, there should be one doctor on duty, one in full or part time specialist, and other nurses should have should observe 4 patients, like for every 4 patients one nurse should be available. And in ICUs where there is very critical conditions and patients on ventilator, so there should be one doctor per 6 beds. So, every 6 beds are very critical patients. For every 6 beds there should be one doctor who is available 24/7, and also there should be one nurse for every bed. That means every patient should be monitored by a nurse and taken care by the nurse. Okay. And if you see what is the average number of staff required for different hospital size or different beds, in the bed size of the hospital, what is the average number of size or staff required? If you see here on the slide, there is 100 beds. For every 100 beds, the number of doctors should be 17 and the staff nurses should be 72. Okay. And if you take 200 bed size hospital, there should be a minimum of 30 doctors and a minimum of 143 nurses to be available. And if you take 500 bedded hospital, there is a 72 number of doctors required and 353 number of nursing staff required. So, for general beds, one DMO per 30 beds per night or per shift should be available, and nurses ratio should be 1 nurse for every 6 beds in the hospital or the general wards. Okay. Now, moving on to the policies. What are the different policies that comes into picture when admitting a patient or making a patient as inpatient? Okay. So, all the hospital policies that are applicable to an inpatient wards are need to be followed in this IP services. Okay. The most important are like initial assessment policy, like when the patient comes to the hospital, so the patient should be assessed before even making the patient as an inpatient, because is it really required for the patient to be admitted in the hospital or not required. So, basing upon the initial assessment, the decision is taken. Okay. Then hospital infection control policies, all the biomedical waste, all the wastage that is generated in the wards needs to be segregated and then dispersed or disposed accordingly. It cannot be collected as a dump and kept somewhere in the wards and stinking, and which causes infection to the patient. So there should be a policy like this wastage has to be segregated, like different color codings have to be available, and then like organ tissue wastage, plastic, or these things have to be separated, needle, sharp instruments, all these things have to be separated, segregated, and the wastage has to be managed accordingly. And admission of medication policy, like whatever the medicines that are being administered to the patients, like different kinds of drugs or IV line fluids that are being administered to the patient, a policy has to be maintained for that. And admission and discharge policies. So when a patient comes for admission, all the policies, whether the patient belongs to a cash patient or credit patient, whether the patient is affordable to put into a special ward or maybe a general ward. So all these policies and counseling has to be provided to the patient at the time of admission. And discharge policies, so every patient who is admitted and going out of the hospital and getting discharged has to be given good counseling about their condition, when to come back, or when to reach in case of emergency, how to handle the things, what are the medications that needs to be taken. So all these has to be counseled and the policies has to be followed. Any incident reports handling. So any incidents that occur in the inpatient ward or inpatient while taking the inpatient services by the patients. So any incidents that happen, like any adverse drug reactions or any falls that would happen in the hospital. So all such incidences have to be reported. And also the inpatient services or wards are also have certain managerial issues like bed management, like depending upon the inflow of the patients into the inpatient ward, like admissions, number of admissions, bed allocation has to happen depending upon their various requirements, like into general wards, economy wards, or deluxe rooms, special rooms, all these things. The bed management is one of the major issues that every hospital faces. And other one is providing a clean and comfortable environment for the patients to stay in the hospital and get the required services. And another important issue is maintenance of stores and inventory control. Like whenever the patient comes, there are different kinds of materials used for providing these services, like example drugs, okay, linen, all these things have to be maintained, and there is no ensure that there is no shortage of such items and there is ample stock available, and these can be provided to the patients as and when required. And another major important aspect is the patient satisfaction, like for whatever the patient is receiving the services in the hospital, the patient has to be feel that all the services are given on time and at the right time, so that the patient regains their health status and gets that satisfaction. This is very vitally important policy that needs to be maintained. And another one is security issues, like there might be small children and there might be certain risks in the hospital, so that needs to be taken care of. And discharge process and turnaround time should be maintained, like during the entire discharge process, the turnaround time has to be maintained for various categories of patients, like cash patients, credit patient, or insurance patients. So the discharge issues or challenges needs to be monitored. So thank you students for listening the part 3 of the inpatient services. Thank you.